Hello, good afternoon, everybody. I'm just going to give just a short pause to let folks come into this space. I recognize it takes just a couple of minutes. There's kind of a delay on our end. So I just want to welcome everybody. Thank you so much for joining us. My name is Susan Barrett, and I am joined by Jennifer Freeman. And we just want to acknowledge upfront the work of Brandy Simonson and Steve Goodman in this document that we're going to be highlighting for you during our session today. So I'm assuming my audio and video is good, and I'm going to get us started. So again, welcome. Just want to make sure we are establishing expectations. Please, if you need to move around, we recognize you've been sitting for a while today, so just move around if you need to. We can't see you. You can engage with us through the chat mechanism, and our colleague Brandy Simonson is monitoring that, so we will definitely have times for questions at the end. But please engage with us. We'd love to hear kind of your thoughts. We know that everybody's been in an innovative space throughout especially the last couple of years. So we'd love to hear about your journey, and we would love to hear about things that are going really well for you. So we recognize that Pathable is slightly different than what we're used to in the Zoom platform. And so I just want to make sure that you are aware that you can navigate the session page and you can interact with us through the chat feature. You can ask questions through the polls, but I find it easier if everybody just asks questions through the chat. So again, would love to hear from you. And if you have a specific question, you can click on the poll feature. But again, you can also just keep in that chat window and keep things simple. Be careful if you accidentally navigate away. I know I've been guilty of doing that even a couple of times already this morning. And if you have any problem at all, we do have a feature on the top part of the blue bar that lets you get access to the help screen. So we've got an amazing group of technical support folks that can help you get back. So like with everything that we do in designing systems of support, everything is a team effort. And as we're working together as a team, whether you're watching this live or you're watching a recording, we would love for you to do watch parties with some of the content that we're providing you over this event. But we want to make sure that you are also, as you're listening in and leaning into some of the examples and some of the resources, that you're thinking about how to do this effectively and efficiently. We want to make sure that it's in line with your community's valued outcomes. And also this notion of deselecting or stop doing things, putting things on the back burner to make room for what we need to do right now. So again, we want to offer some questions for your consideration as you are action planning your way through the content. With that, I want to set up the agenda for this afternoon. I'm going to be talking a little bit about the disaster recovery response. We're learning a lot from the researchers that are in this space. Specifically, I've been following Dr. Kira Malseth, who has done some extraordinary work in behavioral health forecasting in Washington State. So I want to just call your attention to some of the research that's going on there. We're going to talk a little bit about going back to basics and really kind of double down on prevention. And we've got a resource that we are going to highlight that will allow you to kind of use this phases of recovery as a way to make the work that seems so overwhelming right now feasible and realistic. And then I'm going to turn it over to Jen, who's going to talk about how we invest in the core features of a multi-tiered system of support and how that's really allowing the systems that had a strong MTSS system to be flexible and adaptable in redesigning their systems forever. And then finally, we're going to leave time for questions and discussion, because we we would love for you to engage with us, because we know that you are doing amazing work, and it's always incredible to hear about what you're doing. So if you can engage with us, that would be fantastic. So with that, I just want to set the stage with a couple of data points. I think we are all pretty aware of the significant socioeconomic impacts and the variability of impacts across time. I also want to just call our attention to the fact that COVID-19, racial injustice, environmental impacts, from what we're leaning in and learning from our youth, is that they see this all as one collective syndemic. They don't separate the different aspects of kind of what we're dealing with. They just kind of see it as one big disaster. And so with that, I just, and we're going to be hearing from our youth a lot tomorrow and then the following day, but I just want to kind of pull that out. And the social media has really enabled a lot more advocacy in the youth space. And I think it's really time to kind of lean in and have them lead this reimagining the system forever. I also want to acknowledge that many of the syndemic impacts our Black, Brown, and migrant communities and our vulnerable populations at higher rates than others. And this is deeply rooted in long-term social inequities and inequalities, specifically residential segregation, differential access to healthcare and treatment, and even differential access to clean water and clean air. That really kind of sets the stage for that level of disproportionate impact. I also want us to recognize that we had a mental health crisis even before kind of the COVID era, if you will. And these last couple of years have only increased the challenges and magnitude of the problem. As we're addressing multiple crises in this space, we want to recognize the fact that this is not going to be a sprint. We're not going to recover in the next couple of years. This is going to be a journey that is going to take time. And, as we're experiencing right now in real time environmental impacts, I'm in Northern California, where we just had the storm of a century, or I think we broke all records. And then Jen Freeman and Brandy Simonson are on the other side of the US on the East Coast dealing with a really significant nor'easter. So this really kind of sets the context for how we're going to really need to hunker down and see this as kind of just the way forward. We're going to have significant disruptions moving forward. And how do we hold steady on the core features that PBIS and MTSS offer us, so we can adjust in real time to the environmental impacts and other huge disruptions in our education environment. We want to call our attention to the fact that there's been a decrease in medical care. So many of our students haven't received preventative care, even those with health insurance, and there's disparity in that as well. Access to immunizations and disparities in access to education. So again, the variability of the impact is pretty vast. Most recently, October 19th, in fact, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and Children's Hospital Association declared a national emergency in children's mental health. And so, how does, we're all seeing evidence that this is showing up each and every day inside of our schools. And so one of the big takeaways for today is that schools are not going to be able to do this alone. We need our partners in our community. We need our healthcare providers. We need to take full advantage of youth voice, family voice, and engagement. We need our community supports to all come together and invest in a common way of work and invest in redesigning the path forward forever. And while looking at the data can be quite scary, and us living in this time each and every day can be quite exhausting, there's some brilliant things going on, and we really want to leverage all the work that you are doing out there to make sure that kids are going to be successful. And I just want to highlight the work of Tony Biglin right now. He has offered that the potential to reverse all trends and create a healthier way forward is there. We've actually accumulated a wealth of knowledge that leads us to one conclusion, and that really is to make the environments more nurturing, right? So how do we hold both of those things in real time? How do we hold building this ecosystem where everyone thrives at the same time we are responding in real time to the magnitude of need and making sure that we're connecting students and staff to the right supports at the right time? And so again, it's going to mean that an all hands on deck approach, that cascade of implementation, the state, the region, the district, the school, we all have to come together and invest in one way of work. And we are seeing our systems that have really strong MTSS systems that have been able to adapt and really strengthen their system in order to respond to the emerging trends and needs out there. The other thing I just want to elevate is that at the federal level, we have an amazing amount of support as we hold academic achievement and social emotional behavioral health as equal priorities. And Secretary Cardona has put out a lot of tweets that that I geek on, but I just wanted to elevate this one tweet that I think he put out earlier this week. And he says this: "We cannot look at mental well-being as something to do if there's time. We need to make it the foundation on which we are building academic support and recovery. We have to address where students are emotionally before we can access bandwidth for learning." I love this quote because it's exactly what the youth are telling us from across the country. They need time and space to process. They need us to know the story, their story, and how do we position that and hold space for that when we are being asked to recover those instructional minutes. So it's again about having our leaders and having us all kind of come together and de-stressing us from thinking that we're going to recover this quickly in a year. That in order for us truly to recover, we have to situate mental health and wellness into the DNA of the academic community. We also have to make sure that we are being absolutely transparent with our staff, that we're asking them to do something we've never asked them to do before. One of our key messages in our interconnected systems framework, where we're situating school mental health into the PBIS framework, is that mental health is for all. And so in doing that, we all have a role to play. We're not asking our educators to be mental health providers, but we are asking them to do some really small things that have a big impact. And we're going to go over some of those evidence-based practices with you today that will help us be, again, really crystal clear that we are asking our staff to do something different, but we are going to be giving adequate training and coaching and support so that they feel like they are competent and confident to pull in some of the instructional approaches to social, emotional, and behavior support right into the fabric of the academic community. So let's talk about what we know about disaster recovery and response. And again, we are learning from our colleagues in this space in disaster recovery research. And one of the things I know I've been following really closely over the past, I guess it's been almost 2 years now, is the work coming out from Washington State. They have a behavioral health strike force who have been putting these behavioral health forecasting data in play. And one of the leaders in that space is Dr. Kira Malseth, who tells us that this is kind of the general pattern that we see whenever a community goes through a disaster. And although it's been adjusted for COVID, this is the normal kind of pattern of recovery. And we are going to make sure that you get access to her talk because she goes into a lot more specifics than we're going to have time to go in today. But what you're looking at in front of you is really a timeline for recovery. And although we are in reconstruction phase, one of the things that she offers is that in construction phase, in real time, many of our communities are going through a disaster cascade with the onset of the variant of Delta, with the fifth wave, as they're calling it. We are slowing down the process of being in the reconstruction phase. And so what she offers is that the dotted line is probably more of a realistic time frame, but she also offers that despite it being a little bit more challenging than we were first expected, and it taking much longer to recovery than we initially expected, that the most common outcome of disasters is resilience. And we see this in examples from Katrina, from examples in Puerto Rico, where they've had so many things come at them through environmental impacts. For example, in Puerto Rico, as they've been going through several hurricanes and earthquake and now COVID, they still say that in kind of this phase of recovery, that the most common outcome of disaster is resilience. So again, even though it's going to be a longer journey, this message of hope, I think, is one that we need to advocate, and we need to market and message for the communities that we're serving. The other thing that they offer are making sure we're crystal clear on what the common responses to disaster for children and youth are. And she had to remind us, even as adults, and I'm so glad she did this, that many of us feel like because our brains are so exhausted, that we're overwhelmed by all of what we're trying to navigate right now, that we are self-diagnosing with symptoms of ADHD and early onset Alzheimer's. And what she offered is that it's simply because our brains are exhausted and we are working from our emotional side of the brain rather than our problem-solving side of the brain, right? And so that is to be expected. And I think when we hear that this is a normal kind of response, and when we see these behaviors show up in ourselves or show up in our environments, we're not so alarmed, because this is something that we should expect to see. And so she offers kind of the responses in the emotional domain, the cognitive domain, the physical domain, and behavioral domain. And so it's going to be really important that we increase the dose and frequency of biology breaks in our classrooms, that we are all having difficulty concentrating, and that social media and the impact of carrying these phones around also exacerbates that. But she also reminds us that the importance of movement and moving our limbs and making sure that we're integrating neurologically so that we can focus a little bit better. Also, from a physical standpoint, sleep disturbance and nightmares, hyperactivity, physical complaints like tummy aches and headaches are going to be common. And then finally, these extreme kind of behavioral responses, which again, if we can kind of say, these are the ways that our kids are letting us know that they need something different from us right now, and how do we rearrange the conditions to make sure that we're increasing the dose of supports, we're increasing the opportunities to have biology breaks or calming strategies class-wide, school-wide, and that will help us, although not be the perfect solution, but there are some really small things that we can do each and every day in our classroom to mitigate some of these common responses. Okay. And then we've got kind of the next level of teacher exhaustion, which I know we're all feeling right about now. Everybody keeps saying they're May exhausted rather than October exhausted. And so I love some of the pictures that are coming through on social media. So we wanted to kind of share these moments of I feel exactly like this dog right now, and I want to like curl up on a sofa with a blanket and take a nap, I'll just be honest. But we are really exhausted, which means that we have to be really cautious and careful about responding to behaviors that are worrisome in our classroom. We have to put space in between the time that a behavior occurs and how we respond. And so I've been using this for years, where I take a couple of deep belly breaths. And we all have kind of our individual responses for creating space between stimulus and response. So we call that kind of that neutralizing routine in our equity work in PBIS, but it's never been more important that we make sure to recognize the stress and exhaustion, and we don't inadvertently take it out on the students that we're trying to support. So recognizing that level of exhaustion, but and moving beyond kind of this notion of self-care to collective care, and creating systems that prioritize staff wellness is going to be a really important consideration. And we'll get into that in a couple of minutes. So just to kind of summarize, this, the innovative space and the amazing examples out there that you all have been a part of is scripting the way forward. And we know that there is no roadmap for what we've all experienced, but we do have data that suggests, again, that that ecosystem in which everyone thrives is going to be an important consideration. So what do we do at Tier 1, and how do we strengthen and fortify Tier 1 to make sure that we're meeting the vast majority of emotional needs, not only for our youth, but for our staff, which will require us to create time and space to process and continue to process what's happened to us, to create that space, right? Making sure that we build our neutralizing routines. We have an opportunity to practice, and we could even do like a morning staff huddle right before kids show up to practice our neutralizing routine, or ask for special help or on days when we're going through it in our personal lives. And then the other kind of component to this is, we don't have to have the answers to the problems, but we can engage in active listening. And again, offering a really clear, concise reminder of what active listening is and the features of active listening. So, and then again, I can't stress this enough, this message of hope, that the most common outcome of disasters is resilience. So as you're thinking about your own journey on collective care and making sure that you are staying strong through this time, I want you to recognize and really think about what gets you up in the morning. What's your sense of purpose these days? I want you to think about ways that you're going to continue to stay connected to the important people in your lives. I've been so grateful for my colleagues like Brandy and Jen and Steve. We had this awesome opportunity to meet weekly, and we were really emotionally supporting each other as we were writing some of the briefs that we're offering you today. And I just can't say enough, Zoom has been kind of a pain, and I don't think most of us love being on Zoom all the time. But I think it's a great connector. And so I just want to make sure that I'm reminding all of us to get emotional support, not only from our friends, but from our colleagues. Again, adaptability, continue to be creative, continue to adjust, but stay honed on those core features as we move in and out of teaching and learning contexts. And then how do we create a system where we're moving into a challenge state where we do have adequate resources and we do have time to figure out how to use these resources in the context of our classrooms. So we're shifting from that threat state where we feel overwhelmed and we don't feel like we can manage this at all, to more of a challenge state where, yes, there are significant needs arising, but we feel like we've got the tools and the resources to be able to manage that. And that leads us to the ultimate outcome of hope. So how do we invest in and continue to invest in this continuous improvement framework? And I love this definition of PBIS and MTSS, where we're really talking about teams coming together at the state, region, county, district, school level about organizing our resources, right? It's really, MTSS and PBIS are really about organizing the adults and really identifying one or two things that are customized to fit our school community's strengths and needs. We want to put together a system in which we make sure that kids get help early, where we're actively pursuing and uncovering what the strengths and needs are in real time. And we're taking full advantage of the community data that lets us know what's going on around us, and also helps us prepare to prioritize specifically what it is our kids need, because at the population level, there are trends and patterns that emerge before they kind of come into the space of school. So we don't want to kind of wait for kids to fail. We want to be on the lookout for what our kids need and then actively prepare for them so that we're not surprised by who we get showing up in our schools. We want to invest in what's likely to work for our students. right? We want to make sure it's evidence-based, but we want to make sure that the evidence has been tested on kids who are similar kind of demographic makeup as the communities that we're serving. We want to make sure that we invest in our staff so that they can support our students, and that the system is prioritizing, again, that collective care, and we're not just putting the ownership of staff to do that self-care thing, that we are really systematizing that construct. We want to make sure that we are implementing well right alongside us reviewing our student outcomes, right? We'd never want to assign blame for students not succeeding when we're not holding ourselves accountable for high level fidelity of implementation. And along this journey, we're going to continuously adjust based on the strengths and needs of who we're serving and the strengths and needs of our staff. And so it's a continuous improvement logic that we're investing in when we invest in MTSS. I really worry right now that MTSS has gotten so popular that it's almost breeding fragmentation by its popularity, and we are MTSSing in different silos. So this notion of intentionally aligning is going to be important as we work more collaboratively together, and we invest in one common way of work, but we're not situating mental health as kind of a team off to the side. We're actually pulling in our technical experts in the social, emotional, behavioral, and mental health space right into the school improvement team. So we'll talk a little bit more about how we consolidate our teams in just a second. I'm going to take a brief pause and just ask Brandy and Jen, are there any questions coming up or comments that we need to be elevating right now?
I think right now folks are just really excited to hear the content, and I think we'll start sharing some resources in chat that I'm guessing will generate more questions. But I think it's a great reminder that we are watching chat and the question poll. So if folks want to add, we will pause and address those throughout and for sure at the end.
Awesome. Awesome. Thanks, Brandy. Okay, so let's keep going. And again, please engage with us in chat. We really, really want to hear from you. So there's a lot to kind of unpack on this slide, but I think the messages we've been hearing all year is that it is a perfect time to reimagine the system forever. I never want to see us return to the way things were, because the system wasn't working for so many of our students and so many of our adults. And so I think right now, collectively, we need to be bold. Our kids deserve so much more than what we were offering. And while we were trying to do so much for them, we inadvertently overwhelmed by adopting large number of practices, large number of innovations, and we couldn't do anything really well. So how do we streamline this? I've been kind of saying this as we see more money kind of come into the system, that we simply just can't hire or buy our way out of this. And I'm excited that we are hiring more social, emotional, and behavioral leaders. We absolutely need more leaders, but we also need to operate and function differently, right? We just can't continue to maintain kind of a co-located model where we are situating clinicians in the space of the building, but we're not involving them into our school community, right? So we really, as we do hire people, we're going to be, and we'll get into this tomorrow in our mental health strand, but we really need to be positioning our social emotional leaders to grow the capacity of everybody to lean in, to have a role in social emotional and behavioral health inside of our classrooms. So again, it goes to hiring and buying, but also changing the system. I also want to call our attention to the fact that as we are getting more attention in mental health and more money coming in, that wellness is not a place. I worry that wellness centers are popping up, and I want us to really be thinking about the school climate at large and thinking about whether or not we have a healthy environment. And that wellness is something that permeates the fabric of our academic community. And there are academic dimensions of wellness that we should be considering if you've got staff that are really resistant right now to thinking that we're asking them to do one more thing, right? I think of the academic dimensions of wellness being, do you have study skills? Can you calm yourself down when you are feeling really anxious and stressed when you're taking a test, right? So how do we really message this in a way that we are bringing everybody along with us? This is another favorite quote of mine that came out of our friends from Richland School District. We should not hire mental health professionals to be referral sources, meaning, again, we shouldn't be setting up these co-located models. We should be hiring additional community mental health professionals to augment the work that's going on in schools and to be situated across all tiers of support, where they're coming into tier 1 and helping us get that expanded context and lens about what's going on in our community, and expanding maybe to an evidence-based practice that we weren't aware of that already has traction in the community. And I'm not suggesting we add one more thing to the plate, but they can really give us that expanded context. We want to just also highlight the fact that screening is not a diagnostic assessment. Universal screening to uncover students and youth who need internalizing and externalizing needs and supports does two things. It informs tier 1 instruction, and it also helps us connect those students to someone who can do a more interviewing, maybe more of a diagnostic assessment, and then bring that information back to a team so that we can sort kids by different areas of need. So we want to make sure that those systems are firmly in place and we screen responsibly so we're prepared to respond really, really quickly as we might get an extreme number of students who need something from us. I also want us to recognize that ACEs is not a screener, and that's the adverse childhood experience. It's not a screener, and there's a whole session on that that we can connect you with. We also want to recognize that prevention, promotion, and the upstream work that we're talking about right now can be really challenging given the current crisis level of need. So again, it's a matter of all hands on deck and then organizing the adults to make sure we're focused on that tier 1, that ecosystem, that really healthy environment. And we've got a group of people who are creating that system to respond really, really quickly. We always want to make sure we're calling out practices that are not in line with our values. And again, too often, some of the things that we've been doing in education, although our hearts are really big and we've been thinking we've been doing the right thing, has really ended up harming the hurt instead of healing the hurt. And so how do we, in real time right now, say no more to shaming and blaming families and students who show up late to school, right? Without, even if there's 5 minutes left in the school day, holy cow, we're just happy that you're here right now. It is so amazing to see you. Thank you so much for being here. And then deepening our connections with them so we get the stories behind why it might be challenging for families to show up on time. So again, think about those practices, think about those undercurrents that have been permeating education for hundreds of years that really aren't in line with our values, and stop, right? And disrupt status quo. And then finally, if we are going to invest in a practice, whether it's a kernel of an evidence-based practice or we're installing social emotional behavior curriculum, how do we set up those metrics for measuring fidelity and outcomes before we start implementing? It's going to be such an important consideration. And in the mental health space, unfortunately, we simply have been okay for many, many years counting the number of kids who are getting access to care. And that would be like counting the number of kids who are showing up for reading class and calling that our measurement. It's not good enough. So how do we, across all the different domains, academic, social, emotional, behavioral, and mental health, set up those evaluation metrics consistently, right? It's that common way of work that we need to lean into in our school improvement process. All right, so as we set the stage and kind of go into some of these resources, the resources that you're going to see in the next couple of slides start with this definition of mental health. So normally when we think about mental health, too often we think that mental health is something that happens in the space of an office by a mental health provider or a clinician. And I really want you to think about expanding think about a full continuum of mental health supports. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. And it also helps determine how we handle stress, relate to others, and make healthy choices, right? Those behaviors. Mental health is important at every stage of life, from childhood to adolescence, through adulthood. And it's important that we're always on a journey of making sure that we are honing in on being able to name our emotions more succinctly, being able to describe what it is we need to do for ourselves, and advocate for help from our friends and from our colleagues and from the system that we are working and living in. So we set the stage with some of these resources with that, the definition from the CDC. But to put it more clearly, mental health is social, emotional, and behavioral. It's all three of those components. It's how we connect, it's how we feel, and it's how we act. And if you think about the outcomes that have been associated with a randomized controlled trials from PBIS, PBIS actually sets the foundation as you think about that full continuum of mental health supports. PBIS helps us really design that positive, nurturing school environment where the majority of emotional needs are met, right? Look at those outcomes associated with implementing Tier 1 with Fidelity. We see improved student outcomes, including academic performance and social emotional competence. We see social and academic outcomes for students with disabilities. We see reductions in bullying behaviors when you're implementing Tier 1 with Fidelity, and we see decreased rates of student-reported drug and alcohol abuse. I would suggest, if you look at any kind of school mental health initiative, these are the exact outcomes that they are trying to create. So at its foundation, if we're thinking about holding steady on PBIS, or we're thinking about pivoting to a mental health initiative, we're going to argue against doing that. We want you to strengthen PBIS. We want you to bring mental health into the space of PBIS. Think about the reduced use of exclusionary discipline practices when we have a positive school climate. And then think about what happens to staff, their wellness. We see improved teacher outcomes like perception of teacher efficacy. We see school organizational health and school climate increase. And we see perception of school safety. So it is actually of the foundation to launch a mental health initiative. So as we think about this next piece, we want to go back to basics, right? And this brief that was led by Brandy Simonson, Steve Goodman, Jen Freeman, we wanted to offer kind of a phases of recovery. We're recognizing that everybody's feeling really overwhelmed. And we wanted to give something that was incremental, that you could identify where you were in the phase of recovery, and you could hone in on one or two things to do really well, one or two focus areas to do really well before you moved on to the next thing. And so Brandy's going to populate the link to this brief in your chat. So again, if you are here on your own and you want your teams to learn more about this, you can go back and listen to this recording, do a watch party, or you can do maybe a quick resource study, also known as a quick book study, and talk about how you, where you are in your phase of recovery and what you need to do now to meet the needs. So I wanted to hone in on staff wellness for a second, and then I'm going to turn it over to Jen. Most of us right now are in that reconstruction or initial recovery phase. And we are still trying to stabilize the learning environment. And many of us are seeing students who have lost a lot of their social skills that we're needing to go back and reteach. And so this investment in making sure that we are consistent across all of our classrooms and setting up predictable, safe, consistent routines, and we're investing in those tier 1 classroom practice is going to be really, really important. But we also are recognizing that our staff are needing a lot more support right now. So we want to highlight a brief that we developed last spring, and it's built on the core features of a multi-tiered system of support. And we talk about building a culture of staff wellness. And there are some really good tips on how to do this. I've mentioned a couple, like morning huddles, like making sure that you have a quiet space for staff to go to decompress, to maybe practice their neutralizing routine. But there's some really good practical tips alongside some of the ways that we should redesign the system. So I want to just highlight a couple of things here before I turn it over to Jen. Again, as we talk about that ecosystem, we talk about supporting our youth, I want us to make sure that we are promoting wellness for our staff and providing our staff space for that self-care and recovery efforts. I was listening to a superintendent earlier this week talk about having a full week off next week because the staff are just emotionally exhausted, and he's giving them a couple of extra days to take care of themselves. So that's a really good example of a system recognizing that our staff are so exhausted that that they needed to take a break, and they're providing space for some self-care and for some time to plan and figure out a strategy to move forward. And I really appreciated that sense of leadership in the Richmond City Public Schools. I also think we should be leaning a little bit more on our HR departments, our human resources, our employee assistance programs, and our insurance plans. And I'm going to give you an example in a couple of minutes on what our university is doing. But I don't think we're taking full advantage. In other words, I don't think that our leaders who also need a culture of care and wellness. I don't think that staff wellness should fall necessarily on the shoulders of our leaders. And I think if we can take full advantage of some of the employee assistance programming, we can help share some of the burden of creating a system of support for our staff. We want to build awareness and really show benefits of enhancing tier 1. And then finally, we want to reduce demands, right? How do we intentionally integrate? How do we de-implement things that aren't working really well? How do we even just put them on the back burner for right now if we don't feel comfortable stopping a specific practice or an innovation? So here's an example of using employee assistance programming across the tiers. And again, I think most of us have thought about employee assistance programs when an individual needed intensive individualized support. And I just want to suggest this, in our university that Kimberly Yannick, Patty Hirschfeld, and I are associated with, I've been just so impressed with their utilization of their employee assistance program, where they've had really clear, regular communication with us. They have given us ongoing webinar series for coping with stress and learning about the brain under stress. They have been amazing when federal money or additional supports are in place. They've alerted us to that. And they've even done kind of a pay it forward campaign where they asked all of the members of our community to do a letter writing campaign to our students, even if we didn't know them, just to kind of reach out and say, hey, we are so excited that you're joining our community, and just reach out and say that somebody's thinking about them. At kind of the tier 2 level of support, every department was asked to create time and space to do peer checks during our meetings, so that we felt when we were coming into a business meeting that we took time out to kind of get to know each other a little bit more, that we were checking in on each other, that we were practicing a calming strategy, and it really helped us strengthen and connect with each other. They also allowed a flexibility in our schedule, knowing that many of us were teaching our children at home at the same time we were having a full-time job. And then finally, the Employee Assistance Program was really helpful. They increased free telehealth sessions for the members of our community, and they also expanded the menu of options. And so I want you to think about ways that you can connect with your employee assistance program through your HR departments, and really be thinking about how they can support creating that collective care that we've kind of been describing here. The other thing I think we can do at the systems level is consolidate our efforts. And this is an example, and coming from Central School District in Oregon, so huge shout out to Central School District. You can hear more from them tomorrow during our mental health strand, who will be talking about how they have really deliberately integrated through the leadership of their superintendent. But they took an inventory during COVID of all of the social, emotional, behavioral, and mental health teams. And this is just a small list of teams that they all kind of wrote out. These are all the teams that are kind of going on at the same time. And they did a really brilliant thing. They said, you know what, that's too much. And we are bumping into each other. There's a lot of redundancy. So the superintendent and a group of community members, family members, youth, and staff members came together and said, we're going to consolidate all of those teams into one interconnected district community leadership team. And instead of focusing on 10 different things based on the data and based on the empathy interviews, we are going to focus on 3 things. And we are going to operationalize a work group to focus on those 3 categories based on, again, kind of a needs assessment. The first thing they were going to focus on is whole child, whole system support, where they took a really close look at the menu of evidence-based interventions, and they wanted to streamline it and make sure that it fit the specific strengths and needs of the community. The next thing they wanted to focus on was staff development. Again, being really transparent that we're asking staff to do things we've never asked them to do. How do we make sure we're training and supporting and situating staff wellness as a priority in our system? And then finally, how do we do a better job of gathering and getting information quicker and getting students' supports quicker? And how do we adjust that system? And so they had one large, this is their school improvement district community leadership team. They brought members of the community, the technical, social, emotional, behavioral, mental health leaders onto that team. And they identified 3 work groups. What's even more impressive about what they did is that they recognized that that seemed like it was just too much. So they identified the phase of recovery that they were in, and they said, you know what, we're just going to focus on staff right now. That's going to be our number 1 thing we do this fall. And so it really was an all hands on deck. How do we help support staff? So again, I really appreciate their journey, their consolidation at the systems level. And it led to their ability to do more in the meetings. Like when we're asking our staff to do a morning huddle, they don't have a meeting to go to because we've consolidated those meetings and we've protected their morning time. So again, love this example from Central School District. So again, most of us are feeling overwhelmed by all that we're being asked to do. And so I just have an abbreviated list of all the things that, that are kind of running around in circles in our head. And I wanted to offer a crosswalk. This could be something that you could use with your team to reinforce the notion that when we focus on tier 1 components and when we expand, strengthen our tier 1 components, by situating calming strategies and coping skills right into the teaching matrix, for example, we are automatically incorporating a trauma-informed social emotional learning response, a UDL or inclusive practice response, right? We sometimes think all these terms kind of come at us And we think that we have to organize a team and a data system under each kind of shiny new initiative, when in fact, if we can just hunker down on focusing on what is it that we need to do to enhance our tier 1 components, then we're automatically hitting those outcomes that we want to see when it comes time to create a safe, predictable, consistent environment, which is something in the trauma-informed space we need to do. Building community and building relationships, teaching and reinforcing skills, and supporting regulation. So this crosswalk could be really helpful as you identify ways that you are going to expand the utilization of your tiered fidelity inventory and say, you know what, we've been teaching how to walk quietly in the hallway for years. We can incorporate teaching coping skills. We can incorporate teaching those belly breaths right into the teaching matrix, right into those behavioral lesson plans. We don't need to do something completely different. And we can use data to determine which skills we prioritize. We can use the morning circle routine that the restorative practices offers us as a way to engage community and to practice our new skills together. And we can use biology breaks right into the fabric of the classroom when we start to get a little antsier, because we now know that because our brains are so tired, that neurological integration is so important. So getting up and moving is a really central, easy thing we can do that will have a big impact. So what are ways that you're enhancing your tier 1 components? And if you put this crosswalk in front of folks, I think it alleviates that stress of thinking that these are all different competing initiatives. The other thing that I think would be helpful is to identify things that we can stop doing or things that we can put on the back burner for now. And so we wanted to make sure that you all were aware of the Hexagon Tool. This is a tool that comes out of the National Implementation Research Network and has been around for many, many years. And they've recently updated it and have situated a lot of awesome equity questions in the center of this tool. And so again, what can we invest in right now? What are the 1 or 2 things we invest in that customizes and matches our students' strengths and needs? When we are thinking about adding one more thing, and I do not think it's a good idea to do that right now, but when it comes time to do that, where's it going to fit? What's the usability? Do we have the capacity? And do we have the necessary support? So I just want to make sure you're aware of the Hexagon Tool. And I think with that, I am going to turn it over to Jen to continue on with the slide deck. Jen, are there things that are coming up that we should be addressing right now? Or are we good to go?
I will let Brandy jump in with anything as I pull this up.
Awesome.
Thank you for that.
I think there's
setup.
One good question.
Yep. Sorry, go ahead, Brandy.
Yeah, I was just going to say there's one bigger question, but I think we'll save it until the end. So I'm trying to jump into chat, but Susan, there's a couple of questions you might want to jump into chat while Jen is talking.
Awesome. All right. Thank you. Take it away, Jen.
All right. Thank you for that setup. The focus on sort of understanding what we know from other disaster responses and situating what we're all going through, normalizing what we're all going through, I find really helpful to just remember that, like, of course, we're all tired. Of course, we all feel like we have ADHD or Alzheimer's because we're all living through so much right now. I find it really helpful to kind of focus in on that. And the focus on staff wellness is so critical. The other piece that we want to highlight for you all in this sort of first bubble around stabilizing the learning environment is once you've taken care of your staff, that we're all there to serve kids, right? And so the next piece is really to invest in the practices that lead to a positive, predictable, and safe classroom experience for kids. And we're targeting classroom on purpose because that's where kids spend the most time. It's where relationships can be built most quickly and most powerfully. And it's easier to implement in just your classroom than it is to do this across a whole school right now. So if your school is kind of struggling with all of the things, focus in on these 2 areas, focus on staff wellness and focus on classroom implementation. And if you're wondering what exactly do we mean by tier 1 classroom practices, there are all kinds of lists. You can use your favorite list. But here's one that it comes from this brief that talks about how to support students with disabilities in the classroom. And it really details out 10 practices that really make the learning environment accessible to all kids, that ensure that the academic and social norms are known in the classroom, that there are opportunities to practice those and get feedback, and that teachers are actively engaging students in the content and in the lessons with prompts and active supervision and lots of behavior specific feedback and correction when needed. And so this is one brief that is a really helpful place to really detail out what do we mean by those classroom practices and what to focus in on. But if you're like me right now, a list of 10 things feels like too many. And so we want to honor that and say, if 10 things is too many, you have a couple of options. One is to use your school-wide data and select one or two of these that really resonate and would be impactful for your staff to focus in on. The other is to kind of step back a little bit. And in this return to school guide that Brandy was previewing during the opening session earlier today, we really talk about some key things that we need to be thinking about as we stabilize the learning environment and support kids. And that's that we need to connect with kids. We need to build relationships. We need to screen. We need to know who's doing okay and who needs more. We need to provide support by making sure the environment is predictable and safe. We need to obviously teach directly and then monitor to be sure that that's working. And there are a couple of key practices that really do all of those things really efficiently. And so if a list of 10 is too many, there are 3 key practices in this guide that hit all of these boxes for you. And if that feels like 10 is too many, then focus in on these 3. The first is positive greetings at the door, or at Zoom entrance, or at the school door or your classroom door. We want to welcome kids into the space that we're in, for a couple of different reasons. It helps build relationships and form connections, right? To know that somebody noticed that you arrived. It's also a screener. When you get to see how a kid responds to that morning greeting, gives you a sense for how somebody's doing in that day. It gives you an opportunity to provide support and set them up for what they may be experiencing, what's coming next, so you can prompt and remind them. If necessary, you can also teach in this moment and just, go over what the expectation is and provide a little bit of feedback for them. And it's a monitoring opportunity across time, where you can see how kids respond to that positive greeting at the door across time as well, and let you know whether that intervention is working. So one practice, really easy, really cheap, and really effective because it hits all of these boxes. Active engagement is another one that hits all of these different areas. And by active engagement, we need lots of varied opportunities to respond. We're engaging kids in the curriculum, in the activities in the classroom, in the community building in the classroom. Again, it's an opportunity to connect with kids. It's a screener. It allows you to know whether or not they're understanding the curriculum. It allows you to know whether or not they're able to respond appropriately in that situation. It's an opportunity to provide support and teaching and a lot of feedback based on those opportunities to respond. And again, across time, it's an opportunity to monitor. And then finally, specific feedback and ensuring that we're providing more positive feedback than corrective is going to be really important. And again, it gives you the opportunity to do all of these things. Providing specific feedback is an opportunity to connect and build relationships. Letting kids know that you appreciate the effort they're putting in as well as the outcomes. And providing corrective feedback are all ways to connect and engage and build relationships. And again, it's another opportunity to screen, support, teach, and monitor as we go through. And so if again, classroom practices are your focus. You've got a list of 10. If 10 is too many, focus in on these 3. Focus on making sure that we can implement them effectively. It's one thing for your leadership team to identify practices and say, everybody go do it. We know that won't work. And we know, especially now, that won't work. When we have overwhelmed staff, we have exhausted, there's no subs, there's no bus drivers, everybody's pitching in everywhere to try to cover lunchrooms and dismissal and everything else. Everybody's going overboard. We need to be even more intentional about the way we support staff to implement these practices. So if you've selected those 3 practices to implement to support students in your classroom, the next step is to think about how to help build in systems that support teachers with that implementation. And this guide talks about building habits of effective classroom practice. And it's a really great guide because it really it brings us back down to basic theory. And how do we set ourselves up for success? And this is a guide that you can use either as an individual teacher in your classroom. So if you've decided I want to do a better job at greeting my students as they come in, but I need help kind of establishing that habit, this can support you as an individual teacher. And it's also a way to think about how to do coaching and professional development across your school, to think about how can we do this in a way that's really intentional and really efficient and effective. And what it does is it talks about these kind of building blocks of behavior. And those of you that have been down this behavior path with us before will recognize these: the behavior, the thing we want to do, the antecedent, the trigger, or the thing that comes before the behavior that lets us know to do that now. And then the consequence, the reinforcement or the punishment that follows. And so when we're thinking about setting up new routines, if we think about it on the staff wellness side, let's say that you decide that, you want to build in some morning strength training. I will be totally transparent and tell you this is not an example that I wrote. I'm not interested in strength training in the morning, but let's pretend this is your goal. And it's something that doesn't sound very appealing. You need help establishing that behavior and that habit. Then some things you can think about to set yourself up for success would be to put it right on your calendar, schedule it, just make sure you carve out the time to be able to do it. Set your workout clothes out ahead of time, get your water bottle ready to go, make sure that you identify your morning routine, and maybe even find a friend to work out with to make it that much more fun. With those things in place, you're more likely to engage in that strength training. And then when you do, you're going to feel good about it. You can track your behavior. You can keep track of how many days per week you do that. You can check it off your schedule, and you can ensure that habit becomes something that's ingrained in the way you do business. If we're thinking about establishing something like this in the classroom and thinking about how do we support kids, we can think about the same basic steps. What is the behavior we want to do? We want to make sure that we deliver those positive greetings. We're going to teach kids how to do that. We're going to set up our environment to ensure that we remember to do that, add it to our lesson plan, put it right on our schedule or our screen, add a reminder on our phones to get up and go to the door and greet those kids. And then when we do it, we're going to tell ourselves, good job. We're going to celebrate, right? Celebrate with the class and celebrate for ourselves. And then if we forget, we can make those prompts more intense for next time to help us remember. And so using these basic building blocks of behavior, we're able to set up implementation systems for ourselves that make it more likely that we're able to do these basic practices that support both our own wellness and our students. There's a really great example that comes out of Shelton School District in Washington State that kind of brings all of this together. And I'm not going to go through all of the details, but the basic idea here is they didn't put this on individual teachers to do. They made some basic changes to their school schedule to make it possible for staff to have time to check in with students. They made this positive greeting, this warm welcome, a priority, and they actually staggered their drop-off to make it time for that. So they made changes to the drop-off schedule. Staff agreed to prioritize that warm welcome, and the school district gave them time to do that. So with that staggered drop-off, they incorporated the kids ate breakfast in the classroom, both for COVID purposes, but also to help create a small welcoming environment. Staff had an opportunity to connect with students and welcome them and form relationships really early on. And they're going to continue to do this next year. And so that they've recognized the benefits of this warm welcome well beyond COVID. And so I think, it's just a really great example of how they incorporated both staff wellness and a practice that supports students and didn't put it on individual teachers. They created a system that made it possible for people to be able to do this well. And then our last big message for you today is that investing in MTSS and PBIS is something that will help your district and your school be more resilient next time this comes along. Let's hope it's not COVID, but it's likely to be something, as Susan shared. And if you already have PBIS in place or MTSS in place, you're going to be better positioned to know who needs more, to have the systems in place to identify evidence-based practices, to ensure that that the practices that are getting added are the right ones, that there's data to guide it, and you'll have data to recognize who needs more. And it's something that we've kind of noticed anecdotally for years, that when we support a district that had PBIS in place or MTSS in place that had been through a crisis, they were able to respond more effectively, more quickly than districts that didn't have it in place. But COVID's actually maybe a tiny silver lining of all of this, is that we're getting a little bit of data to support this. And so we know that in a statewide project here in Massachusetts, we know that the schools that were implementing with at least tier 1 fidelity prior to the pandemic have been able to actually strengthen their implementation during the pandemic. And they were actually able to build on what they had. And they used their PBIS system to be able to pivot to remote and pivot right back again, and to build in the social, emotional, and mental health supports that were necessary to support students. Schools that weren't yet at tier 1 fidelity, best case, maintained what they had in place, but more often kind of lost implementation fidelity because of the disruption. And so we know how important it is to kind of hit that level of fidelity. A specific example here in Massachusetts, Southbridge Public Schools was able to use their PBIS framework almost seamlessly they wouldn't call it seamlessly. From the outside, it looked very seamless. To transition between remote and in-person. They quickly incorporated the remote expectations into their teaching matrices. They already had systems in place for teaching those expectations and reinforcing them, and they just pivoted it to the remote environment. They were able to use their existing data and then supplement it a little bit with some additional types of data. So rather than just looking at office discipline referrals, they looked at school climate extensively this year, and also attendance. But throughout it all, their main priorities remained climate and culture and reading. And that was comforting for both students and staff. It wasn't, oh no, now we're doing COVID school. It was, we're still doing school, but we're doing it during COVID. And I thought that was a really powerful example of a district that was able to build on what they had done. And you heard some other examples during the opening session this morning as well. And then Susan already mentioned the work happening in Puerto Rico, but there's a fantastic example in Puerto Rico of how they were able to build on their tier 1 system in the wake of multiple crises and disasters there. Really focusing on embedding mental health supports through the integration of the arts within their tier 1 practices. And again, because of time, I won't go into all of the details here, but there is an excellent example of their being able to use the critical features of PBIS, and rather than kind of getting it all blown out to sea, they were able to really strengthen it and make it more intentional and more focused on meeting the social, emotional, and mental health needs of their students and staff. And it gave them a framework upon which to build all of that work. So a lot of that information came from this returning to school during and after crisis. You can find that at pbis.org. And it goes through in a lot of detail the information that Susan and I shared today. I will say it is a long document. I will just point out the fact that it is just broken up into state, district, and school level documents as well. So if you're working at a school, you can just go to the school level document. If you're a State Department person, you can just go to the state level document and not have to wade through the whole thing. Big picture, our key recommendations are to strengthen what you have, build on what you have. Do that by reestablishing your commitment to the work. Talk about why this is so important. We actually have a window of opportunity here where people are prioritizing mental health in a way that's never been done before. And we can talk about how the PBIS framework will make that easier by establishing a really solid, predictable, safe tier 1 environment. We're better able to meet kids' intensive mental health needs. And so we need to clearly communicate why we're doing this, prioritize our leadership teaming and planning, make sure that we're investing in our teams. We know we need to also plan for turnover at this point. And so building on team-based leadership is going to be even more critical. Leverage and reallocate resources. Susan gave a great example of how we can consolidate teams. We can do the same thing around initiatives, and we can find the money that we need for those things. And we need to use a wider sample of data to guide our actions, but data are still critical to the work that we do. And so ensure that whatever it is that you're pulling on to support the kids and staff in your district, you have data to help with the selection process, but also to evaluate whether or not it is working for your students and your staff. And at that point, I'm going to stop and ask you all if there are questions or examples of how you all have done this that we can share with each other.
Thanks, Jen. I did see that Tammy was asking about funding for clinicians who can only bill for direct service, and I think we wanted to address that first. Good news, Tammy, is that we have a whole strand tomorrow that on kind of the interconnected systems framework, and we talk a lot about how important it is to have people who make these decisions around funding and policy be part of the change movement. So we are going to be talking about how we change funding structures, how we use the ESSERS funding and CARES Act funding to supplement money so that our clinicians can be flexible. But I think we could also make the case that when you're serving on a team that's focused on the host environment, that you are providing direct service. So there's all kinds of different ways to kind of think about that. We also will be having facilitated discussions at the end of the day tomorrow. So you can come on and talk with a group of us from the center who can kind of walk through what it could look like, or a plan for moving forward, because we definitely don't want that fee for service model to kind of wag the dog, right? We want to be able to flex out those funding structures.
That was fantastic, Susan and Jen. I think you guys are getting a lot of specific praise and thanks for resources, but I'm not seeing a lot of remaining questions. I was blown away just by how much you all were able to pack into this hour and 15 minutes in terms of both resources, but also words of wisdom and hope. So thank you both for that.
Then I will just ask folks to please complete your session evaluation.
Yeah, we're always trying to make this better. Next year we get to be face-to-face. I think we're all excited about that. But yeah, if you liked what you heard and your team's not with you, we're definitely advocating and supporting those watch parties so that you can see things together and figure out how this is going to work in your system. It's been an honor to speak with you all today, and we're really happy to have you, and we look forward to seeing you tomorrow. Oh, we have poster sessions coming up too, I think, that are live, and you can join us. So with that, we'll give you 4 minutes back of your time, which I'm sure you can use. Have a good day, everybody.
Thanks for being here with us, everybody.